this month in Passport.
Y'all to know I had my mask on, okay? My mask wearer. Well, good afternoon, everyone, and thank you for being with us today. Assisting us with the press conference, Holly May, Larissa Martin, and Dana Martin. Thank you all for being here so much. This afternoon, we're going to be discussing the final report and recommendations of the Accelerate Ed Task Force. When I convened this task force in late April, I asked Dr. Kathy Coleman, Chair of the Saluda County School Board and Director of Clemson University's Sand Hill Research and Education Center, to chair the task force. I'm going to call on Dr. Coleman to share a few opening remarks before we go over the report and recommendations. Dr. Coleman.
Thank you, Superintendent Spearman. As Superintendent Spearman mentioned, she convened this task force in late April and charged us with studying the barriers to school operations and student learning during the COVID-19 pandemic, and then developing recommendations on how schools and districts in South Carolina can best resume school operations this summer, fall, and into the 2021 school year. The 13-member task force, many of which have joined us here today, are representative of all levels of our public K-12 education system, from classroom teachers to superintendents and school board members. In addition to the task force members, 21 individuals guided our work with their knowledge and expertise in an advisory capacity. The State Department of Education staff were also invaluable in providing information to the task force. And I would like to introduce the members that are here today. We have Patrick Kelly, teacher and coordinator of professional learning, Blythewood High School, Richland II. Dr. Brian Newsom, principal, Gray Collegiate Academy. Dr. LaToya Dixon, director of elementary programs and gifted education, York School District 1. Dr. Abby Duggins, Assistant Superintendent, Saluda County Schools. Chandra Jefferson, 2020 South Carolina Teacher of the Year. Missy Campbell, Chief Financial Officer, Spartanburg School District 7. Sherry East, President, South Carolina Education Association. Thank you so much for being here. Since April 30th, our subcommittees and full task force have met a total of 26 times, and on May 26th produced our first report containing recommendations for summer learning and school operations. The work of the task force has been guided by the key principle of protecting the health, safety, and wellness of students and staff while giving students the best possible learning experiences that are as close to normal as health and safety allow. Our task has been difficult, but I am proud of what we have been able to accomplish and the framework for success that we have laid out for our schools and districts. Throughout this process, we have strived to be transparent, taking over 2,000 individual public comments from students, parents, educators, and taxpayers. And we have been inclusive, as we have relied not only on the expertise of the task force and our advisory members, but also those in professional education organizations across the state. I want to take a moment to thank the hard work of these dedicated educators that you see beside me and those who could not be here today. These individuals work diligently, tirelessly, and under constant pressure to contribute to these recommendations and make them what they are today. Superintendent Spearman, I will turn it back over to you to go over the highlights from this final report. Thank you.
Thank you, Dr. Coleman. My appreciation to all of you for helping us out. It was truly a labor of love, and to all the thousands of parents, students, teachers who sent us comments, thank you for taking this very, very seriously. As Dr. Coleman mentioned, our focus from the state level down to each school and classroom must remain directed toward protecting the health, safety, and wellness of students and staff while giving students the best possible learning experience that is as close to normal as health and safety will allow. To assist school districts with planning, the task force has organized its report into 4 phases: immediate actions, summer planning and preparation, pre-opening and reopening, and continuity of operations. Within each phase, recommendations are broken down by traditional district operations. The task force members strive to provide districts with a menu of options to consider as they make decisions for the fall, as we know what may work in one community may not work in another. We have schools that range from about 150 students to over 4,000, so you can certainly understand that. We also know that the COVID-19 landscape and what we know about the virus is changing rapidly and may differ from school district to district. To this end, we have provided considerations for full in-person learning, hybrid models, and full remote learning. What South Carolinians do now, all of us, in adhering to social distancing, wearing masks, and taking the precautions put forth by the Department of Health and Environmental Control, our friends at DHEC, will be the determining factor as to what school looks like in the fall. Today, I'm going to go over some of the important highlights from the Accelerate Ed final report. The full report summary and audience-specific information for parents, educators, and school districts can be found at dedicationtoeducation.com. Dedicationtoeducation.com. First, the recommendations made for those of us at the state level. First, collaborate with DHEC to develop clear criteria for defining the rate of COVID-19 spread, specifically whether an area's condition is low, medium, or high spread. For the state to take the lead on the purchase of the protective equipment. To provide a waiver from state and federally mandated standardized tests. To develop additional distance learning resources. To address the amount of funding the state provides to help districts account for the increased costs they are incurring due to COVID-19 protocols. To develop a school health and safety sharing website and grants. Dr. Traxler, my new wonderful friend, who is an expert and is here with us today, and the team at DHEC have been assisting us throughout this process. Throughout the report, you will find references to the latest guidance from DHEC. This includes school bus capacities and protocols to follow if and when a student or staff member tests positive for COVID-19. As educators, we rely on our public health officials for the latest data and science, and the COVID-19 pandemic is no different. We will continue to work with DHEC to ensure districts know the level of spread in their own communities and can make the best informed decisions. In regard to waiver requests, we will take a close look at each of those and work to provide the needed flexibility so schools can focus on teaching and learning. There are a few that I want to commit to today. I will pursue a waiver for state and federally mandated tests. I cannot guarantee that this will become a reality without action from the United States Department of Education and other state leaders, but I will do all within my power to provide the relief from testing, from those high-stakes tests that South Carolina parents and teachers always advocate that we change. Moving on the recommendations for schools and districts, here are some key takeaways. Two-way ongoing communication from the districts to student, parents, and staff is imperative from now until the start of school. This starts with surveying parents and staff and making decisions informed by their input. Some of you parents may have already received surveys from your own school districts asking what your intentions are with your children in the fall. Please respond to those. Addressing the social and emotional needs of staff and students. COVID-19 has placed extreme stress on everyone, and school communities will need to be prepared to offer support services when students and staff return. This includes the prevention of bullying and harassment surrounding COVID-19, establishing policies and procedures for distance learning. We know that not every parent nor teacher will feel comfortable returning to in-person instruction, no matter how many safety precautions we put in place. Schools must be prepared to serve these students and make arrangements for these educators. In the event distance learning must be utilized on a wider scale, we must be better prepared than we were in March, and I believe that we are, and I know that we will be even better prepared when school opens in August. Preparing school facilities and classrooms. Districts should develop cleaning protocols based on the latest DHEC and CDC guidance and determine if the volume can be handled by custodial staff or should be supplemented with contracted services. Frequently touched surfaces such as desks should be cleaned often using approved solutions. Classroom settings need to be arranged to practice the largest degrees of social distancing possible. Schools should be outfitted with signage that illustrates social distancing and health precautions that need to be adhered. As districts consider their operations for the fall, it is important that they be guided by the following principles. While scheduling, districts should always seek to provide students with the best possible learning experience. Greatest priority must be given to ensuring the health, safety, and wellness of all their students and staff. This requires aligning all scheduling decisions with the latest recommendation and guidance from public health officials about best practices for preventing the spread of COVID-19. Districts should avoid any scheduling scenario where the burden falls on a teacher to simultaneously create and implement traditional and distance instruction for students in the same class at the same time. While the optimal learning environment for most students would be in person with a teacher close by, districts and schools should have plans in place to adjust scheduling models during the school year in the event of a decline or second wave of COVID-19 in the area. A scheduling model that works in August may not work the whole year. Again, the full report summary and audience-specific information for parents, educators, and school district can be found at dedicationtoeducation.com. And I'll be happy to answer any questions that you may have at this time. Yes, ma'am.
What are you doing to make sure that these schools do have funds available? What are you advocating for?
Well, if you've been with us in this room during Accelerate SC, you know that I went to the Accelerate SC committee and they responded. The governor also included as part of his recommendation that schools be reimbursed, school districts be reimbursed for cleanings, for the personal equipment. We have already ordered cloth masks for all teachers in the state, for all custodians in the state, bus drivers, cafeteria workers, as well as face masks for students who would be attending summer school that should start in just a few weeks. Also, we're working very, very closely with the state legislature now as they prepare to appropriate the CARES Act funding. So we're working with them and believe we'll be successful. The school districts have also received funding from the U.S. Department of Education through the CARES Act. Our agency has received $216 million. 90% of that flows directly to school districts, and the districts have quite a bit of flexibility. They have almost 2 years to spend that funding, and they have 12 categories that they may choose. And it is up to those local districts to send us a plan, but one of those categories is equipment, cleaning, so there should be ample funding to support that. And we will continue to speak out on behalf of school districts because we know this is not going to be over in just a short time, but we'll be going to the legislature when it's appropriate to ask for additional funding as needed.
The Senate's plan that says school districts will only get that summer camp money if it's face-to-face.
Yes, we're working closely with districts. There is no doubt that face-to-face instruction, particularly for young children learning how to read and do math, kindergarten through third graders, is best with an adult face-to-face. So I do agree that that is the most ideal. Unfortunately, in this situation that we're in right now, there are some places where it may not be possible to have face-to-face instruction. And at that time, I do believe we should fund the virtual if the district feels that they can give a quality program. So it's a little bit of disagreement there now, but we're working very closely with the legislature.
Spearman, if some school districts continue to do the virtual learning, I know we discussed about the broadband issues and that the kind of disparity, technological disparity. Can you give us an update as to where the state's at right now in terms of helping people with Wi-Fi?
Sure. We're doing a number of things right now within our agency and working with other agencies to better prepare the school districts who were not able to offer a high-quality distance learning in March that will be better prepared. A couple of things. As you know, Accelerate SC, the recommendation from Governor McMaster, which I believe the legislature will fund, was $20 million toward buying hotspots. That will absolutely help. My staff is working very, very closely now with the Department of Administration on that. We're also looking at the broadband plan. What are the best next steps to make sure that every family in South Carolina can receive some type of broadband service? So my staff is working very, very closely there. We're giving the information to those who have been given that charge to lead, to show them where are the students living, who are they, what do they need from their what do those families need. So we're working very closely to supply the information of where the disparity exists and the best way to better prepare. Part of that also, though, is having the device is one thing, having the service at your home, that's all important, but you've got to have a teacher who's well trained. So we're also working very closely with the Education Oversight Committee and making sure that we have the professional development ready so that our teachers will feel comfortable giving good virtual instruction. It's not the same as in the class, so providing that, we are using much of the funding that the agency is receiving from the U.S. Department of Education for professional development for teachers. So we're trying to be better prepared, ready to go. Many of the districts, we're also encouraging them to purchase devices with their U.S. Department of Education funding. If they did not have enough devices now, we're giving them advice on which ones to order and how to get that here in time for school starting.
Plans the districts have submitted for how they're going to spend their chunk of money. What are you hearing? I mean, is there one thing most are doing with it?
I would say we have, as of this morning, I believe about 40 of the districts have sent their plans in, and we're trying to turn those around very quickly. A few of them are already getting funding because they asked for reimbursement on food cost. You know that we've served over 16 million meals since we shut down school on March 16th. And each of those meals was served at a loss to the district. So they are asking for reimbursement, which that is another recommendation that Governor McMaster made to use for the CARES Act funding. So that reimbursement of food and labor costs there, the purchase of cleaning devices, cleaning equipment, masks, paraphernalia, all of that's important. A lot of these districts are using their money for enhancement on their technology, to purchase the devices. Some didn't need to use that in that area, but those who did, that's a big priority, first priority for them to buy the devices. Now, this funding is a little different in that we have 2 years to spend it. And one of the areas that they can use it is on operations, which includes salary. So in anticipation that there could be less revenue in the future due to a downturn in the economy, some districts are holding some of their funding back to be able to keep teachers on the payroll, to keep folks working, should that come to that state later on during the pandemic.
When do schools have to have their plan for either returning or doing distance learning? When do they have to have that submitted to you?
We're asking for that as we speak. I don't know that somebody help me there, have we placed a deadline on when those plans? No. The- Patrick Kelly, would you like to speak to that, Patrick? Come. See, when you know the answer, you get at the top. Patrick Kelly, one of our teachers.
So in the Phase 4 section of the task force recommendations, there's a recommendation to districts to announce their plan within 20 days of their scheduled first day of school. Now, earlier in the task force report, there's also suggestions to districts to revisit their calendar for the coming school year and potentially make adjustments if needed based on local health conditions and facilities. And we ask districts to continue that ongoing two-way communication with parents and families and community members so they're aware, but 20 days is the day we're asking for that to be shared out to districts and communities.
Thank you. Yes, sir.
For schools that may be large with students and it's kind of hard to social distance, do you anticipate any change in the school curriculum or school hours during the school year?
I think all of those both, the question is, do I anticipate any changes in school hours, school schedules due to the facility size and the how difficult it is to social distance? Yes, I think that there are districts now who are looking at their facilities, their classrooms. Our staff is working with them because they're varying ages of building. Right now, if you built a new school, you would need to have each classroom at least 800 square feet. Not all, some are much larger, some are smaller. So district personnel are looking at that right now, moving, adjusting classes, which class should meet. They are already working on possibly changing furniture in the rooms, going from tables to desks, or making the necessary changes. So that is definitely a part of the evaluation that school principals, facility folks in the districts are making right now.
Can you go over the testing policy if a student or teacher contracts the virus?
Yes, and I may call on Dr. Traxler to help me with this so that we get that right. So Dr. Traxler, do you mind speaking to that protocol?
Thank you, Superintendent Spearman. And we have worked with the Department of Education as well as with our school nurse liaison and folks within DHEC to be developing those protocols and recommendations for people in the schools for if a staff or student were to test positive and were to be sick. And the main premise of it is around cohorting the students in as much as possible so that there is limited exposure if a student does test positive. There, of course, are recommendations then for notification of appropriate, parties, parents and whatnot. And so that is all stuff that we are finalizing at this time. But yes, that, in terms of monitoring and everything, we have those protocols in the final stages.
Are there extra testing at schools just in general? Are you guys working to make sure that schools have adequate testing?
We are. That is something we're looking at very closely, especially for the fall, is the ability potentially, to test, at least periodically, if not, all the time at schools. And so that is something that we're working on.
Question for Superintendent Spearman. You did mention that some parents were uncomfortable sending their kids if the school decides to do in-person learning. Will there be options available if the school has in-person, but the parent feels like, I still don't feel comfortable sending my child to school?
That's a great question. Thank you. Will we have options available for those parents who do not feel comfortable sending their children back to school? And those reasons may vary. It could be a medical condition that the child has, or just the anxiety and worry that parents may feel about bringing the virus home. Yes, districts are working. There's several options. Many districts are setting up their own virtual school. Some already had those in place where students could take all of their courses online through a district-operated virtual school. We have Virtual SC, which is a virtual program run through the Department of Education that is free. And I'd like for parents to hear this because it is free not only to public school students, but to all private school students and homeschool students. A wide variety of courses that can be taken virtually, mostly high school, but we are enhancing our content to add middle school and a few elementary courses there. So that's another option. And then finally, we have some wonderful charter schools in our state that are public schools that are free and are completely virtual. And so that option is there as well. So I think parents across South Carolina need to look at this very carefully. I know that most school districts want those children to still come and be a part of the population, and hopefully in person. But if they're not in person, there are many districts who want to offer that option to their own students. While others may not be able to do that fully, then parents should consider one of the other options I just mentioned.
Recommending that teachers be tested before returning to in-person learning, and do you foresee potentially a teacher shortage of teachers who don't want to return to in-person?
Right. Well, we appreciate our teachers. We need them, and we need to keep them safe. And obviously, we want to do everything we can. As far as the testing, Dr. Traxler, do you want to speak to that also, please?
Thank you. So at this time, we're not recommending routine testing for all teachers or all students coming back, understanding that the currently best available test is really a snapshot in time. And so, you know, it shows that you might be negative one day, but you might still be incubating the virus, for example, if you're exposed before then and become symptomatic and contagious, you know, potentially even a few days later. So understanding the limitations of that testing, we're not recommending it at this time, but we continue to monitor all the advances that are coming about in everything related to this virus, including testing.
You said you would pursue a waiver. Obviously, that's something teachers have been really clamoring for. Tell me why you support it and how you think that time could be used.
I have been overwhelmed with outcries from teachers and parents pleading to consider this, and I've listened to them. I think that the time that we could save by not doing all of the standardized testing in the spring, and for sure the anxiety that our teachers and students have, and we need to relieve that as much as possible during this pandemic, as well as it's used often for comparative information, which we did not test this previous spring. And with all of those reasons, I stand on the side of the teachers with this. And again, I don't have the authority on my own to make that happen, but I certainly will speak out and be the voice of teachers and parents on this issue. There are other folks who will have to have a say, including the U.S. Department of Education, including other state leaders here in South Carolina. But I will be speaking out on behalf of the teachers and parents on this issue to not give the spring testing in 2021.
Dr. Traxler again, but I know you guys will be working with DHEC to determine low, medium, and high spread of an area. Looking right now, when we're seeing 1,000 new cases today, I mean, when you look at these areas that may not have enough testing, how do you feel about recommending, hey, you have low numbers right now, so maybe you could return?
Right. I'll speak just a moment, but I would like for Dr. Traxler to speak on this again, and I want the public to know this again. We are talking daily, and decisions that we are making on education are relying on teachers. On healthcare issues, we're relying on the healthcare experts. So this is a great collaboration that we have going on between our agencies. But yes, in our report, we list low, medium, high, and many states have used that same model. We are working now to get more into the details of how that should operate, and we'll be working and communicating with our local district superintendents and the chairs of their school boards for them to make the safest and best decision based on that data. Dr. Traxler?
Thank you. As Superintendent Spearman said, we are communicating very frequently, and will continue to be. Certainly the testing available in an area is a factor to consider. There's a number of different metrics that we are and will be looking at in terms of just giving advice on the level of spread in different communities at that time.
And if I may just say one other thing, I am extremely concerned about the spread of COVID-19 in South Carolina. I don't know how anyone could not be with seeing these numbers. Who would ever imagine a few weeks ago that we would be seeing over 1,000 cases a day? We have got to change our ways, neighbors. We have got to do a better job. And the things that we know now that work are wearing masks, social distancing, washing your hands, and if we want to go back to school, And really, we've got a summer school that's supposed to start in 2 weeks. If we want that to happen, and we want our children and grandchildren to be back in school, everybody has got to do their part. And that means following the guidelines that these health experts say. So I'm pleading with you because I'm working as hard as I can. These folks are working as hard as we could to get things ready for school to start. Children need to be in school for many reasons. But we hold the key right now in our own hands as to whether that's going to be able to happen by how well we follow the advice of our health experts with wearing masks, with social distancing, washing our hands.
Another recommendation is that teachers not have to come up with two plans, an e-learning plan and an in-person for kids in the same class. So how will that work for kids who maybe have, learning disabilities and have to be at home, or they have underlying conditions? How will teachers still accommodate them if the majority of kids are choosing to be in person?
Right. Well, we think it's only fair, and we want to be very fair to our teachers because this is difficult to move through, but teachers should not have to do both. They should not have to prepare lessons for the children in their class and then turn around and prepare lessons for virtual. So that's why we're trying to give as much support as we can by developing content at the agency that can be used virtually, by offering more virtual programs, and districts are doing the same thing by offering their own virtual schools. And probably some of the teachers who cannot come back and work in classes because of age or health issues may have to do a little extra training and become virtual teachers. That would be very, very appropriate. So those are the type changes that are going to happen, but we want to be fair on the workload for our teachers, that they should not have to do both.
Teachers are not required to get tested as of right now. In terms of temperature checks for all kids walking to the building, will that be a necessity? And also in terms of the materials, like hand sanitizer, wipes, are we good on supplies, or where do we stand on that as well?
So I'll let you speak to the second question. As to the first one, we are certainly advocating for symptom, checks and symptom reminders frequently to students, especially in the morning, that if they feel ill at all, to let their teacher or administrator know. And that's, those are details that we'll continue to evaluate the guidance coming out of the CDC and working with the Department of Education and school districts to see what is feasible but yet also safest.
While teachers are teaching in person, or children, do they need to wear masks right now or not yet?
So we think that mask wearing is necessary to help slow the spread of this. And so we certainly very strongly encourage and really recommend some sort of either a mask or for teachers, I think there's the option of a full face shield coming down from the forehead. But we really do think that's necessary, not just at school, but in a lot of parts of our public life. So.
And I would like to reiterate that we, as a state agency, we are working with school districts right now to help them purchase the equipment, the masks, the hand sanitizers, the disinfectants, the sprayers that they need. We're working with them to collectively buy that at a very good price, to be smart with those purchases and to assist districts in all that. So we've been surveying them over the last few weeks and making those type purchases on their behalf.
Another question with regards to testing. Obviously, we've seen DHEC ramp up testing across the state. So why not in schools? You said you're not kind of advocating for that right now because it's kind of a snapshot in time. So why test everywhere else throughout communities and maybe not think about doing it at schools?
Well, I think, again, we're following the advice of our health experts. It is a snapshot in time as needed. We may be doing some more of that at school, but it certainly at this point won't be a test that every child has to take in order to enter the door. Would you like to speak on that?
So just like we do for all of our testing events, we really encourage the majority of people who are being tested, if you have symptoms, even mild ones, whether it's somebody that's in a school or somebody out in the community, go and get tested. And that's really our main effort in ramping up, especially is to communicate that with mild symptoms, you should go get tested. It's not like it was originally when it was only if you met certain criteria. But in terms of using it as a widespread screening, because of that snapshot in time aspect of it, it just is not, it is not the most useful, certainly assessing children, parents assessing them every morning for symptoms, even taking their temperature before they go to school has a lot more yield.
This certainly is going to be one of those times that we always need to have our parents as our partners, but during this pandemic, we need our parents as partners more than ever. They've done a great job as our surrogate teachers over the last few weeks, but they're going to need to help us and take this very seriously each morning as they check on their children, getting them ready for school, that they're healthy and should be going to school each day.
Pandemic moving forward affecting substitute teachers? Would it be harder for them to get work with teachers being able to work from home now? How are they affected?
Yeah. Question is, how does this affect substitute teachers? I think probably in the same way. There may be some need for even more substitute teachers, as teachers might get ill and have to be at home, or for certainly those teachers who don't feel comfortable coming in teaching. So I think there'll be plenty of work, and I'd just like to encourage anyone, if they're unemployed right now and they have a teaching degree or a 4-year degree and they're interested in teaching, there's ways for alternative certification for folks to come out and help us, because we're going to need some high-quality people there on the ground in these classrooms when school reopens.
You said you're concerned, obviously, about the spread of COVID right now. If we don't see these numbers decline and major change by August, do you think it's smart to have in-person education and learning?
We will face that as it gets closer. Certainly, if the virus is running rampant, we're not going to sacrifice the safety of our children and our teachers just to say we're going back to school. We're going to do it safely. I want them there. Everybody wants them there. We will be there. But we've got to do our part and tamper this increasing rage of the virus here in South Carolina. If it continues on the same path that we're on right now, it's going to be extremely difficult for us to be able to go back face to face. But hopefully we'll see a change and things will start decreasing, because folks will be taking it seriously. Anything else? Well, thank you so much for being here today, and task force members, thank you all for being in attendance. Thank you.